In this lesson, you would know about the history of social welfare and evolution of social welfare administration. The objectives are, on completion of this lesson, you would be able to know about history of social welfare and evolution of social welfare administration. Concept of social welfare. Before we discuss about the evolution of social welfare administration, we will recapitulate the understanding of concept of social welfare and social welfare administration and know briefly about the history of social welfare and social welfare administration. According to Friedlander, social welfare is the organized system of social services and institutions designed to aid individuals and groups to attain satisfying standard of life and health. It aims at personal and social relationships which permit individuals the development of their full capacities and the promotion of their well-being in harmony with the needs of the community. The definition is very clear and comprehensive and gives us a very clear understanding of concept of social welfare. However, we have to keep in mind that the concept of social welfare is influenced by time and place. The welfare needs of last decade do not remain the same today, and what is expected today by social welfare will not be the same in the coming decades. The concept of social welfare is influenced by evolving social, economic, political and cultural trends, and therefore this term cannot have fixed meaning and hence needs to be redefined time and again in accordance with the existing situations. The history of social welfare can be traced to the earlier group living in joint family system. People lived in groups out of the needs, the physical protection, social security, food gathering, procreation and the like. The need to care the children and elderly members of the family resulted in the emergence of earlier forms of community and society. Afterwards, joint family became a very stable social welfare unit in which common human needs were met and the concept of social responsibility was thus recognized, and the future of social welfare can be seen in the progressive expansion of the joint family and community or society, and the responsibility to take care of the children, elderly came to forefront. Later, concern for poor, disabled and needy added to the list of beneficiaries. It existed in all societies at all times, but the concept of welfare state and the development of the organized front of social welfare system have a recent origin. Social welfare in India. Evolution of social welfare in India is as old as Indian society. The evolution and development of social welfare in India can be broadly classified into three periods. Pre-British period. During the pre-British period, social welfare was an integral part of the Hindu religion. Hence, it was the responsibility of the family and the community. There were several charitable institutions for poor and disabled. Later, the responsibilities of social welfare activities were taken over by the state. Therefore, all the rulers of this period have undertaken measures of social welfare. Several activities of social welfare undertaken by the ruler were building hospitals, roads, shelters, rest houses and the like. There were village panchayats to look into the social assistance and social security and protection of children, elderly and weaker section of the society. They were responsible for giving free medical facilities to the people. Ancient rulers also built roads, established charitable institutions, and almost all the rulers personally took interest in the problems of poor farmers and cultivators, disabled and destitute. At the advent of British rule, the Indian society was by and large orthodox and custom bound. Every kind of custom and rituals received sanction under the cover of religion. Then prevalent customs of sati pratha, untouchability, devdasi, dedication of women to temples, caste system were all the norms of the society. The British rule brought in the new way of thinking characterized by rationalism, democracy and liberalism, and it influenced and motivated several social reformers of the time to raise the voice against the social evils prevalent in the Indian society. Consequently, social welfare during this period evolved in the form of social reform movements. Important among them was reform movements initiated by Brahma Samaj, Arya Samaj, Ramakrishna Mission. They successfully raised the people's opinion against the evil practices prevailing in Indian society and succeeded in introducing legislation as a relief from the existing social evils. After independence, social welfare activities were undertaken in a more organized way, and it was based on the Indian Constitution, which empowered the state to promote social welfare programs and meet the basic needs of the poor and weaker section of the society. Thus, social welfare programs were included in the 5-year plans and have taken shape in the stages in the course of the plans. In each plan, a target group was identified and funds were allocated for meeting their needs. Social Welfare Department was established to coordinate the social welfare programs of the country. Social Welfare Advisory Boards was also established in all states and union territories to coordinate the activities of voluntary organizations in the nation. A considerable portion of the financial assistance from the board is extended to voluntary organizations through the state boards. Thus, passing through different stages, social welfare in India has acquired its current status of organized activities. In India, social welfare is always dominated by the values of humanitarian, spirituality and individuality. Society does not impose any welfare measures on its citizens. People are free to decide whether to make use of the provisions under a particular programs or not. It also considers individual capacity with regard to the solution of the problem which confronts him. Social welfare recognizes that several factors can lead to one particular problem. Hence, a detailed study of these factors is done before planning a welfare program to help a client or community. Such a program has greater chance for success. The government also believes in the collective responsibility of the government, various administrative staff, entire community and individuals in attaining the goal of welfare state. Commitment, coordination and responsibility on the part of all individual departments and institutions concerned are essential in attaining social welfare in India. Social welfare across the world. It is essential to know the ideological or value framework of social welfare activities across the world. Social welfare in United Kingdom is identified with the term welfare state, which Richard Titmuss criticized, referring to it as an undefinable abstraction. In general, a welfare state is defined as country that establishes income support programs and services such as those envisaged in the renowned Beveridge Report, Social Insurance and Allied Services, Macmillan, New York, 1942. This was a report proposing social welfare provisions for the entire population of country from cradle to the grave. In pursuance of the report, Britain developed a comprehensive social security system to fight what Beveridge has called the 5 giant evils of want, disease, ignorance, squalor and idleness. In Britain, The essential ingredients of social welfare have been the guarantee of a national minimum social security with children's allowance and comprehensive health insurance available to all. In United States, there has been wide-ranging development of various forms of social assistance and social insurance under both public and private auspices. However, programs for special categories are usually relied upon means test to protect the population from poverty. The insurance-based medical care provides limited physician and hospital services to eligible aged and poor, while the means based on medical aid provides comprehensive medical care. In Canada, a highly organized and reasonably efficient system of social welfare activities is provided to needy and poor. This is because in Canada, social welfare is conceived as a broad term that covers a system of legislation, social policies, programs, institutions, resources, activities, and services. It ensures its people to access to all those activities, services, and programs that is necessary to help them to develop their potential as complete individuals in a way acceptable to themselves with regard for the right of the others. All nations have developed social welfare services as they moved from agrarian to industrial economies. The role of family in protecting the members is reduced in the modern complex societies, and it demands the need for an external agency to provide welfare in all countries. Welfare is now the concern of both public and private agencies. Concept of social welfare administration. Today, social welfare activities are well organized and do not happen by chance anywhere. Social welfare is a planned and organized activity in today's world, and the state has a greater role to play in this field. The planning, organization, and implementation of welfare activity is what we mean by social welfare administration. Kidney defines social welfare administration is the process of transferring the social policy into services and the use of experience in evaluating and modifying policy. Social welfare administration is a continuous process involving certain stage. Planning is the starting point. In this stage, objectives are defined clearly on the basis of which broad policies are formulated, and the way and the means of achieving these objectives are identified. Planning is followed by the organization of the staff by assigning those duties and responsibilities in order to materialize these plans. Appropriate staff needs to be selected, trained, and recognized for their work, and they also need to be directed properly to get the work done. Social welfare administration is a teamwork. No individual can work alone in this process, and hence there is a need for coordination among the activities of all members concerned in the different stages of the process. The whole activity need to be budgeted because finance appears to be the backbone in the materializing these objectives. Finally, the whole process needs to be reported. Reports serve as feedback and help in assessing the role of its success and identifying the limitations according to which necessary modifications can be made in the policies and the programs. The aim of the present study is to analyze these stages of administration in the context of institutional services for children in need of care and protection and identify its limitations and problems. Social welfare administration includes the organization of welfare services in both government and non-government sector. Evolution of social welfare administration in India. Social welfare activities were undertaken in India since time immemorial. Earlier social welfare measures were taken up by joint families. Later, it was undertaken by rulers, reformers, and religious groups. The role of government was insignificant. Such an informal and voluntary activities could afford to lack of organization and administrative structure. Since independence, Government of India had taken keen interest in the field of social welfare. Consequently, the state could realize the need of administration and infrastructure in execution of social welfare programs. And thus, social welfare moved from an informal and voluntary activities to a formal and organized activities, and thus the birth of social welfare administration in India. Indian Council of Social Work played a very significant role in the development of social welfare administration in India. It was Indian Council of Social Work who raised the voice for the creation of a Ministry of Social Welfare at the central level. Indian Council of Social Work was later renamed as Indian Conference of Social Work. Just after independence, trained social workers began to feel that there was no organization at all India level of social welfare professionals where they could meet and discuss the strategies to develop their profession. A similar feeling was expressed by a group of voluntary organizations based in erstwhile Madras, which are later named as Chennai, led by the Guild of Service, and as a result, All India organization came into force at Bombay, later renamed as Mumbai. The first conference was convened in Mumbai, and for the first time, the subject of social welfare in all its perspective was discussed. It was a very stimulating session from which originated the Indian Conference of Social Work. The historic birth of Indian Conference of Social Work was followed by the creation of its first state branch at Chennai. Several sessions were held later on in different states, and branches of Indian Conference of Social Work were established as well. The work of Indian Conference of Social Work gathered momentum, and they succeeded in formulating and ensuring the adoption of an institutional framework for social welfare. In 1953, for the first time, the Indian Conference of Social Work presented a memorandum to the central government urging the formation of a Ministry of Social Welfare with a corresponding setup at the state level. The intervention of Indian Conference of Social Work on the legal and legislative front have given rise to many laws. On the program side also, they took a daring lead. On the international scene, promising links were soon established. In 1952, the first International Conference of Social Work was convened in Madras. Indian Conference of Social Work continued to expand its scope of activities. Today, when ministries and departments of social welfare have blossomed forth at the center and in most states, Indian Conference of Social Work can take its share of credit for the achievement. The year 1964 is a landmark year in the history of social welfare administration in India. The Department of Social Welfare was formed in 1964 at the center, which was later elevated to the Independent Ministry of Welfare under the central government. Social Welfare Department was part of the Ministry of Education and Social Welfare. This department looked after the child welfare, women welfare, family welfare, welfare of the handicapped, social defense, rehabilitation of displaced person, welfare of scheduled caste and backward classes, etc. Some of these functions were previously dealt within the Ministry of Education, Health and Home Affairs. The Department of Social Welfare was changed with a full-fledged ministry in the year 1979. The activities of the ministry were carried out through 3 bureaus, each headed by a joint secretary. These were Nutrition and Child Development Bureau, Social Security and Handicapped Welfare Bureau, and Women's Development and Social Defense Bureau. The planning, Research and Evaluation and Monitoring Division provided technical support to the activities of the ministry. With the formation of the new government after the general election in December 1984, the Ministry of Social Welfare was renamed as Ministry of Social and Women's Welfare. With the reorganization of the several ministries in September 1986, the erstwhile Ministry of Social Welfare and Women's Welfare was reorganized into the Ministry of Welfare and the Department of Women and Child Development. The Ministry of Welfare was to look after the welfare of the scheduled caste and tribes, minorities, and other backward communities, welfare of disabled, social defense programs, etc. The activities of the ministry were carried out through 3 divisions and 2 cells. The Department of Women's Welfare was now part of the Ministry of Human Resource Development, which was under the charge of a cabinet minister. This department was brought under the Ministry of Welfare in 1990, but was again transferred to the Ministry of Human Resource Development in 1991. After the formation of new government in 1998, the name of the Ministry of Welfare was changed to Ministry of Social Justice and Empowerment. The ministry continues to be called so even today and aims at meeting the social welfare needs of the people in an integrated manner with a progressive outlook and with optimum use of country's resources. The Central Social Welfare Board is the key organization in the field of social welfare administration in India. The Central Social Welfare Board was formed in the year 1953. It comprises of a full-time chairperson and members representing state and union territories. Its general body consists of 51 members headed by the chairperson. She is appointed by the central government in consultation with the Ministry of Social Welfare from amongst prominent women social workers. The administration of the affairs of the Central Social Welfare Board is vested in the Executive Committee nominated by the government from amongst the members of the Central Social Welfare Board. The Executive Committee comprises of 15 members, including the Executive Director. The board is administratively organized in a number of divisions and sections. The board coordinates between the programs of the Central Social Welfare Board and other departments, also between voluntary organizations and the government. It is funded by the Government of India, and the funds for the programs as well as non-planned expenditure of the board are a part of the budget of the Department of Social Welfare. The state social welfare boards have a similar and parallel structure, but the regional and state variation exists in northern and southern states. The state social welfare boards have been established purely as advisory boards to advise the Central Social Welfare Board on the institutions requiring assistance and their eligibility to get such assistance, while the grants were sanctioned directly to the organization by the Central Social Welfare Boards. Summary: social welfare is the organized social services and institutions designed to aid individuals and groups to attain satisfying standards of life and health. It aims at personal and social relationships which permit individuals the development of their full capacities and the promotion of their well-being in harmony with the needs of the community. The concept of social welfare is influenced by the time and place. The welfare needs of the decade do not remain the same today, and what is expected today by social welfare will not be the same in the coming decades. The concept of social welfare influenced by evolving social, economic, political and cultural trends, and therefore this term cannot have a fixed meaning and hence needs to be redefined time and again in accordance with the existing situation. The planning, organizing and implementation of the welfare activities is what we mean by social welfare administration.